morning, students. Today, this is a practical spotters class regarding cardiovascular system and kidney. So, as I already told you, I'll be telling now the few important sample questions which is important in these chapters. Okay. First is furosemide. So, what is furosemide? As we all know, it is a high saline diuretic or loop diuretic. Okay, high saline diuretic or loop diuretic. So, the important questions we can ask first, which group of drug does it belongs to? You have to tell it is a high saline or loop diuretic. So, mention its mechanism of action. It inhibits sodium chloride transporter, okay, which is present in the thick ascending loop of Henle. So mention is two uses. So one is to treat the edematous condition in congestive heart failure or pulmonary edema, and also it can be given for treating hypertension. Okay. Then what are its adverse effects? This is a diuretic. So the main adverse effect of furosemide will be, first is it causes hyperglycemia because it inhibits the insulin release. Second, it also causes hypokalemia, okay, and hyperuricemia. So it increases the uric acid levels. So it causes precipitation of gout. Then, so these are the few adverse effects. So in spotters, we can ask any one or two questions. Either write the mechanism or mention these two uses, two adverse effects. So you have to read detailedly about this drug. Then give another example of same group. So same group, other examples will be torsemide, bumetamide, okay, torsemide, bumetamide, ethacrynic acid. So these are the few other examples which belongs to same loop diuretics or high saline diuretics. Then mannitol. What is mannitol? Mannitol is an osmotic diuretic. So mention its two uses. The two uses of mannitol will be, it is used to treat the cerebral edema, okay, and also it can be used for treating the increased intraocular pressure, that is glaucoma, and also it is used for treating the oligouric state, that is where there is no urine formation in case of soft patients. So there are three uses to treat cerebral edema, then to decrease the raised intraocular pressure aging glaucoma, and also can be used to treat the oligouric state aging soft patients. Then mention its adverse effect. This is an osmotic diuretic. So what are the adverse effects of this mannitol will be? First is it causes increasing the excretion of the glucose. Okay. Then give another example of the same group. What is the same group? Other osmotic diuretic is glycerol. Okay. Other osmotic diuretic will be glycerol. Then captopril. What is captopril? It is an angiotensin converting enzyme inhibitor, that is ACE inhibitors. So give another example of the same group. So apart from captopril, it can be benazepril, then perindopril, ramipril, enalapril, lisinopril. Okay, you have to give the other examples. Okay, lisinopril, enalapril, ramipril, benazepril. Okay. Then write its mechanism of the action. So it inhibits the angiotensin converting enzyme and prevents conversion of angiotensin 1 to angiotensin 2. Okay. Usually angiotensin 2 causes vasoconstriction and sodium and water retention. So it inhibits this enzyme. So angiotensin 2 cannot be formed. So it causes vasodilatation. Then mention is two important side effects. So the main important side effects will be, first is it causes hypokalemia, and second hypotension. Okay. And captopril also causes, it contains sulfhydryl group, so it causes the sulfur-like allergic skin rashes. Okay. Then explain the reason why it is contraindicated in pregnancy. So because ACE inhibitors, when it given in the second and third trimester, it causes fetal hypotension and damages the fetal kidneys and causes anuria. So it is contraindicated in the pregnant ladies. So read detailedly about the AC inhibitors. Question can be asked anything regarding this AC inhibitors. Here we have kept captopril. In exam we can keep any AC inhibitors. Can be enalapril, lisinopril, anything. Losartan. What is losartan? It is an angiotensin receptor blockers. So write two uses of this same. It is can be used in case of hypertension and also it can be used for treating the MI. Okay. Mention one advantage over AC inhibitors. As you remember, the AC inhibitors AC is an enzyme which causes conversion of angiotensin 1 to angiotensin 2 and also it helps in degradation of bradykinin. So when you inhibit this AC enzyme, the bradykinin cannot be degraded, it remains. And bradykinin is a vasodilatory peptide. Okay, so it causes and also it is an inflammatory mediator and it causes angioedema and also brassy cough. Okay, the patients taking AC inhibitors, mostly they complain of angioedema and brassy cough. So losartan, what is the mention one advantage over AC inhibitors? See, these are ARBs, that is angiotensin receptor blockers. So they have nothing to do with the AC enzyme. So bradykinin will be degraded as usual. So there is no accumulation of bradykinin. So there will be advantage will be that it causes no brassy cough and no angioedema. Okay. Then metoprolol is a cardioselective beta blocker, that is beta 1. So mention another drug from the same group. So what are the other cardioselective beta blockers you have to remember? So one is I wrote here metoprolol, other can be atenolol, acebutolol, then beta hexolol, celiprolol, okay, then metoprolol, esmolol, nebivolol. So these are the another cardioselective beta blockers you have to remember. Okay, atenolol, acebutolol, beta hexolol, celiprolol, metoprolol, esmolol, and nebivolol. Then mention two conditions where these cardioselectives are safe compared to non-selective. Non-selective means propranolol, okay, oxbrinolol, nadolol. These are the non-selective. So what are the two conditions where cardioselectives are preferred? That is in case of asthma, we can give, and also in case of diabetes. Then amlodipine. What is amlodipine? It is a calcium channel blocker. As you remember, calcium channel blocker is further subdivided into dihydropyridine group and non-dihydropyridine group. In dihydropyridine group, you are again further subdivided into long-acting, short-acting, intermediate-acting. So amlodipine is a dihydropyridine group, a calcium channel blocker, and also it is a long-acting calcium channel blocker. So and we know all dipines. Okay, all dihydropyridine group of calcium channel blockers are powerful vasodilators of both pulmonary blood vessels and coronary blood vessels. So name two conditions in which it is used. One is hypertension, another one is angina. Okay, but in angina only it is used in a particular type of angina, that is angina of effort angina. Not it is used in case of any unstable angina, or what you say is a variant angina. There are three types: no, stable, unstable, and variant angina. Variant angina is otherwise called as premental angina or vasospastic angina. Okay, so what happens in vasospastic angina? Why this is contraindicated? Because in vasospastic angina already the coronary vessels are in vasospasm, okay, constricted states. So this amlodipine is a powerful vasodilator. So when it causes vasodilatation, there is fall in BP. And we know whenever there is fall in BP, compensatory mechanism, sympathetic discharge will take place and we have reflex tachycardia. So more tachycardia, more in angina already the patient is in ischemic state. That is, there is oxygen supply is less. So when it causes reflex tachycardia, it does not show any beneficial effect in the patients who are having already coronary vasospasm. So this is not it is not useful in case of angina with vasospasm. or vasospastic angina. Only it is used in the angina of effort and hypertension. So right to adverse effect, it is a vasodilatation it causes, so there can be headache, then tachycardia, thrombin headache will be there, flushing, palpitations, and ankle edema. Then minoxidil. What is minoxidil? It is an arterial vasodilator. Okay. Mention this mechanism. It acts on the potassium channels which is present in the vascular smooth muscles, and it opens the potassium channel and causes hyperpolarization and vasodilatation. Okay. So it is a potassium channel opener. So mention is two uses. One is hypertension and second is it is also used to, you can see it is available in the form of topical lotion 5%, and it is used mostly in the male pattern of baldness. Okay, because it stimulates the growth of the hair shaft protein. Okay, and mention is adverse effects, same vasodilatation, so there will be mostly headache will be there, and then flushing and palpitations. Then digoxin. What is digoxin? Mention the source of digoxin. So digoxin is mostly from the leaves of Digitalis purpura or Digitalis lante. Okay. And mention two extra cardiac side effects of digoxin. So apart from cardiovascular side effects, some extra cardiac effects will be there of digoxin. That is, it causes endocrinal side effects like gynecomastia in males, and also it causes CNS side effects. Okay. And GIT like anorexia, nausea, vomiting, and kidney it causes diuresis. Then mention is two uses. One is it is used for the heart failure, and second is it can also be used for paroxysmal supraventricular tachycardia or arterial flutter and fibrillation. So right this mechanism, we know that it inhibits the sodium potassium ATPase pump which is present in the cardiac cell membrane. Okay, so these are the few questions of digoxin. So detailedly read about digoxin, any question can be asked. Then next is nitroglycerin. What is this nitroglycerin? So nitroglycerin is nothing but it is a vasodilator. Okay, vasodilator mostly used for the angina patients. Okay, so mention is route of drug administration. Orally this drug is never given because it has got very poor bioavailability. So what is the other route we are preferring is subcutaneous. Whenever the patient will have chest pain, we give this tablet subcutaneous. Okay, because it bypasses the liver and causes it bypasses fast metabolism and it has got excellent bioavailability. Then mention is uses same, it can be used in angina patient, and also it is used to in cyanide poisoning. Okay, cyanide poisoning, and also it is used to treat the esophageal spasm. Okay, then mention is adverse effects. Same, it causes vasodilatation, so there will be flushing, and also it causes thrombin headache, and there is one disease which is Monday disease. Okay, remember Monday disease, which is caused to, which is seen the patient when with the persons taking nitroglycerin. There is some industry where these workers are exposed to nitroglycerin. So when they are exposed to nitroglycerin, this is a vasodilatation. So it causes flushing and thrombin headache. So what happens? Monday to Friday they have been working, and then they are exposed to this drug, and they will be showing symptoms like thrombin headache. Saturday, Sunday, we know it is a weekend period, so they will not be exposed to this drug. Okay. Then again, when they go to Monday, again they are exposed to this drug and they may develop a headache. So it is called as Monday disease. But soon after repeated exposure, they develop nitrate tolerance. Then adenosine. What is adenosine? It is mostly used for the cardiac arrhythmias. So mention the mechanism of the action of adenosine and mention one important use of adenosine. So this is your homework for the people I want to give. So please read thoroughly the mechanism of action of adenosine. Okay. I will be asking questions in my next class. So these are the few spotters regarding cardiovascular system and kidney. Thank you.